At its core, this report is a call to action for common sense. It's common sense that ultra-processed, nutrient-poor food contributes to chronic disease. It's common sense that excessive screen time and isolation lead to anxiety and depression, especially in children. It's common sense that over-medicating kids is dangerous.
So the Health Secretary, RFK Jr., MAHA Commission releasing its highly anticipated report on the state of America's health with a big focus on childhood chronic disease. Let's bring in Dr. Oz, the administrator for the Centers for Medicare and Medicaid Services. Doc, thanks so much for joining the program.
Honored to be here. I must say, when you sat through the different testimonies, what you walk away from after having read the MAHA report carefully is the fact we need to double check a lot of the assumptions we have made. And for all the parents out there, the same way you double check to make sure your kids are okay, we got to double check the underlying facts behind why we do certain things to our kids, because we have made it easy for them to be sick. And I've got to say that's a moral hazard, obviously, but as the person in charge of managing Medicaid, it's a financial hazard, because Medicaid, which covers, Medicaid and CHIP covers 50% of kids in America, the bill we're paying for Medicaid has gone up 50% over the last 5 years. So we've got a moral hazard and we have a financial risk.
So, Mr. Administrator, let's look at this full screen, because I think it tells the story. It says more than 40% of American children now have at least one chronic health condition. Is that true?
It is true. 1 in 6 kids are obese. By the way, we have obesity numbers in America that are twice that of any other developed country. That's not just an accident. That's not genes. That's changed dramatically. We've got a quarter of kids with allergy issues, a quarter of kids with prediabetes. That dramatically increases their chance of having complications. It costs a lot to treat that, and heavy kids become heavy adults. But we also got a quarter of young men, teenagers who have ADHD. We've got a quarter of teen girls who say they've got big-time depression. These are massive shifts over a very short period of time.
So let's talk about some of the why. It's said that it's poor diet, aggregation of environmental chemicals, lack of physical activity, and chronic stress. And then you got the over medication that's going on as well. What can we do in the short term to turn this around? I know there's going to be a lot of policy and regulations that are going to come that you guys are working on, but for the parents at home, if they want to do better at home, what can they do right now?
Well, you win the battle for health in your kitchen, your living room, your bedroom, Lawrence. So I'll give you 2 concrete things right this second, and then I'll give you some hope about the future. Number 1, get those kids outside and playing. And they need an hour a day of some activity. Only about 15% of kids, that's 1 in 7 children, get an hour of activity a day. That's standard to any human species survival, is your young kids can go run around and learn how to do things while they're playing with each other. So get them out. And the second is give them real food. You heard Secretary Kennedy talk about 70% of the food being ultra processed. Just give them food that comes out of the ground looking the way it looks when you eat it. Real food that you can recognize. Those 2 things alone will make a dramatic difference and help the country. It's also your patriotic duty, because less than a quarter of kids are eligible for the military because they've got underlying health issues. Yeah. Now, that stated, what we're really going to do with this MAHA report is begin to study the underlying principles of so much that we're doing. All the recommendations we're given, we're going to challenge the status quo on toxins in the environment, the medicalization of young people, so they end up in the healthcare system, in the sick care system, where they shouldn't be there. There are lots of moving parts, but my agencies, Medicare and Medicaid, were created in 1965. That's 60 years ago. We haven't done something like this in this entire time period, although we've been paying the bills. And President Trump drove this change.
Yeah, it's been a long time coming. Mr. Administrator, I only got about 20 seconds. Real quickly, you guys are putting a stop to the boosters for everyone. Why is that?
Well, we're asking, again, that folks go back and kick the tires on what's really in their best interest. So the FDA lead, Marty Makary, has said in a beautiful article this week in the New England Journal that you need to give boosters, if you want, to seniors, but you can't force them on young people because we don't have enough evidence that it makes sense for them. So we're still going to pay for it. CMS will pay for these booster shots for COVID, but it doesn't make sense for us to demand, insist, or mandate that.
It's not necessary for everyone. All right, Doc, I think you guys are following the science on this. I'm glad we got new folks in that are looking at the actual numbers now. Thank you, sir.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.